So in rehabbing from an injury, rehabbing from trauma or surgery, look, we know that it's a complex psychosocial, endeavor. What's my role in society? How do I move around? I'm at week 3 today out of this knee resurfacing. And what I want to do is focus a little bit on this idea. We have big window, right? Or big picture, and then little picture, little window. And little window, little picture means that I'm working locally at the tissues. I'm not looking at how well I'm moving. I'm not looking at my sleep. I'm not looking at my role in society and goal setting and et cetera, et cetera. I'm looking at what the heck is happening in a local tissue phase. Now, it's easy to always pan back out and say, the psychosocial is just as important, but it's easy to also drop the ball on the bio, which means that we aren't necessarily empowering people to take full care of their tissues. So when we address sort of a systems approach, one of the things that we know is that, hey, this is a capsule, or I've got to heal the joint capsule, which they opened up, right? I've got muscles that are stiff and trying to hold on and stabilize, but I also have what we call sliding surfaces. So this is our nice catch-all, and this sliding surface, in full transparency, came from a brilliant, brilliant mind named Gil Headley, who describes it as a simple way of looking at, hey, is your skin sliding over the skin underneath of the dermis? Is it, how does that relate to the tendon? How does that relate to the joint? Right? Because if you have the skin is super tacked down, then it's like an exoskeleton, and that exoskeleton skin doesn't move fluids very well. It's low oxygen, just not as healthy. Now look, you can touch any skin on your body and realize that it should slide and glide over the surfaces underneath it. And if you have the reference limb, which is always nice, you can see that I can pucker the skin around my knee like a Shar-Pei, right? And that means it's kind of free. So I come over here on the surgical side, and my knee is getting better, and I'm making progress. And look, notice that it slides a little bit, but it doesn't pucker a little bit. I got a little bit of motion. So enter one of my favorite uses of cupping. Now, people are big fans of cupping. It has been around a long time. Do I think cupping enhances squat movement, power? Maybe not, right? Having a very acute spot where I'm trying to unload it, where I'm trying to bring blood flow back or just give some relief, or if I want to restore sliding surfaces, that can be very powerful. Our friend Sue Falzoni, who has written a wonderful book and is one of the brilliant sort of icebreakers of PT, ATC rehab. She's like the Amelia Earhart of physios. One of the things that she says is about looking at like KT tape or even cupping is it's a way of just of periodizing some of the loading, in so much as that sometimes when we're loading tissues, it's always compression. So compress, 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 Normatec compress, Voodoo Floss compress, everything's compressing, and so sometimes pulling away is a way of just giving the tissues a break and having a slightly different stimulus. So even if you just look at it from that way, you're like, okay, that makes sense, right? So this is a really simple and cheap kit I got off Amazon because I don't need very much, right? And I'm not a Chinese medicine practitioner. I'm not trying to address sort of flow or stagnation in the rest of my body, but I want localized spots here because what ends up happening is, look, we've cut through all the fascia and I want to make sure that this skin slides and glides and it doesn't actually adhere and heal with these kind of verticalized spines running through all the way down, because that's going to make it really difficult for these tissues to ultimately be able to give me enough slack to restart to move. So one of the things that is easy to do here locally, I just throw in a little aloe gel, right? I just rub the cup in here. And what's nice is that instead of just me grabbing a wet towel and trying to shake, which I do obsessively, I'll be in the car and just shake my hand or use my hands to get these tissues moving. All of a sudden I can load just a little bit of a cup, and then all of a sudden, look at all the motion I can get in here. So it's really easy for me to get a ton of motion in these tissues without a lot of sort of more mechanical compression. It's easy for me. I can go really small and get right up next to what I'm trying to get and get a lot of motion in here, and got a little bit too much lotion on there. Pin it down. And I can do that with multiple ones at the same time. So if I'm thinking, hey, let's just be passive on there, maybe that's one way of thinking about it. How do I improve blood flow in these areas, right? Secondarily, though, what I'm thinking is how can I use these cupping tools to get a ton of motion into the lateral tissues. So it's a simple way of unloading and then restoring sliding surfaces without adding compression, which can be very, very powerful when people have scars and we're trying to manage this. Now, I'm really trying to be careful because I still haven't had complete healing here. So at 3 weeks out, you can still see I've got the little scabs from my sutures. The actual incision itself down is pretty closed. I've got a little spot up top which gets irritated because that's the suprapatellar pouch. That's where all of the slack of my flexion is, and that certainly has kind of been bugged as I've started to flex this thing a little bit. So I'm really trying to respect the spots, so I don't have to necessarily get right on the incision. I can sneak in and around the incision. And even if I didn't have cups, right, I can be moving back and forth and trying to just make sure that I am keeping an eye on these tissues just not becoming stuck to the layers underneath them. So whether you want to use the adhesion or stagnation or poor sliding surfaces, whatever the mechanism is, understanding that, hey, there are some cheap tools out there that can really give you some access and appreciate that motion is lotion. So keep in mind, right, you are responsible for the small tissue window kind of small picture ideas here, and this is a simple way of getting a ton of movement in around surgical sites without irritating the direct surgical site and feeding slack to that global system, so that ultimately when I stand up and start moving again, I have the tissue capacity to do that. Especially when the joint is effused, especially if it's swollen, I can't really get all of the normal motion that I normally would from just like biking or squatting, right? So this is another way of getting movement without a lot of motion in there, and should definitely be on your radar for managing surgery. Again, super cheap, super simple idea, and we're not trying to solve global problems with this. This is a local small window idea. Cupping.